Welcome, and thank you for attending today's HIMSS Industry Solutions webinar, Strategies for Delivering a Secure and Personalized Clinical Desktop, sponsored by Aventura. During this webinar, you'll learn how to deliver a personalized clinical computing experience that combines fast access, single sign-on, and protected health information security features to support mobile clinicians. You'll learn details about this innovative new platform, see the technology in action, and hear how it is transforming clinical workflow in leading health systems across North America. Our speaker for today's event is John Gobron, CEO of Aventura. With that, I'd like to turn it over to John to begin our presentation.
Well, thanks a lot, Bill, and thanks for everyone for joining the presentation today. I really appreciate you taking the time. When I do presentations like this, I try to put myself in your shoes as the audience and try to anticipate some of the questions you might have. I thought you might have a question on what is situational awareness. It's something that Aventura talks a lot about. Thought you might want to know about some of the benefits that situational awareness brings around securing the workflow that we do that other solutions might not do. And I thought you might want to know about how health systems like yourself have done things like this. How have they used situational awareness to benefit their organization? So hopefully those were some of your questions. And I'll be happy to answer those as we go through the presentation today. As Bill mentioned, there is a question and answer box at the bottom, and anything that you want to do, any questions you might want to ask, you can type in there and we'll address them towards the end of the presentation. But as we go forward, I'd like to start off by maybe a bit of a level set and talk about what we consider the state of the desktop, the clinical desktop right now in healthcare. And it's still a pretty confusing place. Lots of things to use. Sometimes it's not even a desktop anymore. There's carts on wheels, there's mobile devices, there's a traditional computer, there's wall-mounted computers, there's tablets, there's iPads, there's things like that. So the clinical workflow really has gotten complicated over time in an era where the design was to make things become more simple. And when we say simple, we talk about how does a clinician use these things so they can deliver better care, better, faster care, in many cases, and ideally less expensive care. This has all been predicated on our journey through the meaningful use phases, and most organizations are through 1 into 2 and looking forward, and a lot of organizations, according to places like HIMSS Analytics and the U.S. government, are through a big part of this journey. So they're at a state where the EMR is now being used in a meaningful way, ideally, but it's the legal record. You, as a clinician, have to chart, have to prescribe here. So what does that mean? Now that we, as an industry, have driven clinicians to the desktop to use the electronic health record, what we found as a collective is that it's hard to get to. It's not easy to get on the system. There's multiple delays. You're forced to manually do things that you don't really want to do. You get some things on some device, you get other things on another device, and it's not as intuitive as you'd like it to do, and it's hard to find the information you want. If you're a user, these are some of the things that pain you. And if you're an IT shop, then you have a similar set of challenges in that you are dealing with the users, so you have a highly dissatisfied and often case disengaged set of users, but you also have a different problem that the users don't face as much, but you do, is protecting this data and making sure that no one absconds with it, either through a desktop or by getting into your network. And what we see across the country, and what we know from a industry analysis, is that roughly half of the industry right now has unprotected desktops, unprotected workstations. If you go into hospitals, you find that anyone can access a machine and get on these things, get on the network, get onto applications, and that's not really a good thing. And to quantify what not a good thing means, it's about a $5.6 billion problem. It's not a small problem. The cost, or the value, I should say, of a healthcare record is roughly just a little under $400 which means if you're a bad guy and you know how to hack an organization, healthcare is presenting more and more as a soft target. And, if a hacker gets into Target or something like that, that's a valuable entity, but if you get into a health system, it's worth twice as much. So they're coming, and they have been coming. The instances of breaches, it's a daily or weekly occurrence in some news, some health IT news or something like that. And it's expensive. Across in our industry, it costs the health system about $2.5 million to deal with a breach, whether that's through remediation and fines and those kind of efforts. So it's not an inexpensive proposition on any front. Everybody loses, in other words. So what do we do about it? Well, we're actually started by making the problem more complicated rather than less, because in addition to the EMR, we still have other applications that clinicians need to use to deliver care, and that's only increasing as our industry matures past meaningful use and into what is commonly be called value-based pricing or value-based care. We're bringing another set of applications on to manage analytics and manage population health and manage secure communications and things like that, things that are generally not found in the EMR, yet they're becoming more and more important at the point of care. So we're asking our clinicians to log in just at a time where it's harder, and they have to do it from all over the place, multiple physicians, multiple locations, multiple days. It's a problem that just keeps getting worse, not better. And then ultimately, where I think our industry is headed positively is with the focus on the patient. And if you're a physician or a nurse or a caregiver and you are constantly dealing with the computer, you're not dealing with a patient. And here we have an unhappy young man who's looking at his watch rather than having a conversation with a doctor. So this is really emblematic of a common complaint we hear across the country. I spend too much time doctoring the computer and not enough time doctoring our patients. So what do clinicians do about it? Well, we really see about 4 things that happen most often. Is one, they don't log out. They log on, or someone logs on to an EMR, and they leave it open. They walk away. They don't care so much about security. They don't care who else uses it, and they wait for a screen time or something else like that to come up. Obviously, that's not great. If you're a better user of an EMR, we see this probably the most, is the users do log out. They are cognizant of what lies behind the log-on screen of the EMR, but they don't really care about the desktop. So they just log out of the EMR, leave the desktop open, and you see that a lot, particularly in shared areas. We also see clinicians where they're just using a generic log-on and the shared IDs and things like that. And those also tend not to pass meaningful use muster, but it still happens. And then you see the old Control-Alt-something, Control-Alt-Delete or something like that, that effectively reboots the computer and causes a big delay, because now the device has to reboot itself, and no one else can use that computer until it's rebooted. So these are this is what's going on in industry, and lots of efforts to automate these and things like that, but a lot of them haven't been implemented or aren't as successful as what could be. So what Aventura does to address this is a technology we call situational awareness. Excuse me. And situational awareness simply means that through the Aventura platform, we know who you are, we know where you are, we know who the patient in care is. So from a workflow perspective, a user can log in with a PIN, they can tap in, they can use a biometric. They get to their device in their chosen manner, or the manner that the IT group has decided is best. Aventura takes over and uses our patented awareness to custom mold the desktop based on what applications they're supposed to get, what access they're supposed to get in those applications, and in many cases, who the patient is. So that's what we mean by situational awareness. And here we have a similar graphic, but instead of having to log on multiple times, Dr. Jane puts her badge in, she authenticates with her PIN, and there's her desktop, and we know who she is, we know all the things that she's supposed to get, and we deliver to her. So what does all this mean, which is kind of the important thing? So when you put a solution like this in, first thing generally people see is a big reduction in time, close to 70% reduction in the time you used to spend navigating the machine to switching that to giving care. But what we usually talk about first, particularly with IT and security folks, is that now we've locked down the desktop. We have made it so the front door is locked so that inappropriate or unauthorized access does not happen at that machine. Common analogy I like to use is if you are a bank manager and some bad guys can tunnel under the bank and get through your laser system and crack the vault and steal all your money. That's kind of hard to protect against that level of theft when you put in that many control anti-measures. But if you're the same bank manager and you leave your door open over the weekend and someone walks in and takes your money, that's something that easily could have been prevented. And we see that, analogy similarly with the desktops in the computer. Most hospitals have done a very good job securing their data centers or their vaults with encryption and lots of security measures. And most organizations have not done, interestingly, the same amount of effort on securing that front door. But it has benefits both from the security side as well as from the user side. Most of these stats here are around users, because if you put something that's highly secure in front of doctors and nurses and it's harder to use, they won't use it. So we have the unique combination of making it more secure, but also improving the workflow at the point of care. So we talk about this, in some nice slides, but what does that mean in the real world? So I have a couple of case studies from some of our customers. One of them is Hunterdon Medical Center in New Jersey. Hunterdon is a 178-bed hospital. 13 of its past 14 years it's been most wired. It's a really well-run place. And they've had the Aventura solution for a while. Before that, they had the challenge of basically a crazy environment, a difficult environment to know what apps you're going to use, when it's coming, what I should be using, what I shouldn't be using. And like I was talking about earlier, data security and patient safety with respect to electronic health record were really secondary to getting the job done. So what they did was they just left the screens open because it was the fastest way to do things. And it presented a lot of problems, even though it made it fast to get in and out of. Oftentimes they would chart in the wrong record because the user forgot to change the patient. Simple things like that you think are difficult to imagine, but if you think about a clinician doing this 60 or 70 times a day, every day of their work year, mistakes are bound to happen, and that's exactly what happened here. And it just makes for an unhappy use of the computer, basically. The nurses are tethered to it. The patients don't like it. You hear this complaint a lot from patients and sometimes from patient advocacy groups, is everyone's spending so much time in front of the computer and no one's caring for the patient. So this was the situation that they were faced with when they put the Aventura solution in. And we really got that. Here's some data from same customer on what they saw. So they basically a clinician spent roughly 29 minutes per day logging in and out of applications and desktops, and they got that down to 9 minutes. So they saved, roughly 20 minutes per day, or 70% of their time. So added up over the course of a year, that's a pretty significant number. Significant in the terms of close to $500,000 when you factor in nursing time, value of their time, and running a 365-day-a-year operation. So what do you do when you're wanting to set this up? You recognize that you have a problem, desktops are not secured, clinicians are not happy. What's an organization to do? So we spend a lot of time talking to our customers and prospective customers about this, and there's really a few simple things that you can do to get things going. The first is do an internal assessment. Most organizations have already done this and are pretty well aware of what goes on in their clinical workflow. Involve clinicians is a given. If you're going to be doing things that impact positively, hopefully, and even sometimes negatively, get their input and make them part of the solution. And then the third is what we see with our customers is what I tend to say is don't boil the ocean, but start with just securing the desktop. Put a really simple solution out there, lock down that desktop, enable access through a badge system you may already have or a PIN system that we can put in, and just improve the security and begin to improve the workflow, and then move on to the more complicated things like predictive workflow and knowing what applications need to be accessed, where, how to get into those applications, what patient record to put them on. Those are all great things to go have as a goal, but really starting simple and beginning with a security solution and locking down those desktops is what we find when our customers take this approach. They generally have a lot of success. And we look at this along a continuum, I like to say. We think about security, we think about that as a user focus, putting in two-factor authentication, prepping for electronic prescription of controlled substances, making it so that effectively unauthorized people cannot access a desktop and authorized people can get to their information as soon as possible. The next step along the journey is what we call a personalized desktop. So auto-provision applications that a user is supposed to get and add in, the concept of location awareness. When I'm in the ED, I should get these set of applications. When I'm in surgery, I should get these set of applications. When I'm in my office, I should get this. When I'm at Starbucks on my iPad, I should get this. Things like that. And then along the journey, the next step along the journey is this striving towards interoperability, which is the next step of taking these applications and enabling bidirectional communication from the EMR or other multiple data sets to target applications, such as the ones I mentioned earlier, like, analytics and pop health and care communications. A lot of these things that are coming down that a lot of hospitals are looking at to start the journey of reducing cost and involving their clinicians in those processes. So we really look at this as a platform, and like a lot of platforms, we believe that starting in a manner that we understand and can help our customers come out with a successful project and then grow that over time towards their common goals of improving access via personalization and improving clinical care and in the business of healthcare ultimately through interoperability. So with that, I'll take a quick pause and let you know that we'll be at HIMSS. We're booth 1324. Most of this information in some form or another is on our website, and as is the ability to request additional information or reach out to Aventura in any way. And with that, I will flip it over to the question part of our presentation and see if we have any questions. I can see the screen. I don't know if the users can, but I can see the screen and a couple questions.
Yeah, I'll be happy to go to questions now.
Sure.
One of the questions, John, that we have is, how long does it take to implement?
Great, thank you. So again, by taking a prescriptive approach to our customers' implementations and deployments, we can do this in a couple days. When we start with a security solution, we have a very lightweight client. Implementation is on the easier side of things. In provider-based and outpatient healthcare, I don't know that anything's actually easy, but in terms of implementing it, it takes a couple days and you're up and running. So it's a very lightweight lift, and we have a very prescriptive approach to this. So it's not a big project. And what we find that is our best results happen when a customer goes up and implements the secure desktop, lets it run, effectively bake in for a period of a couple months, and then begins the journey of saying, what next? Now that I've done this, where do I take my next steps? And to do the same thing over again and start that journey towards personalizing the desktop, and at the same time start thinking about and then enacting on that journey of introducing interoperability to the clinical workflow.
Okay, we have another question from an attendee today. How does this differ from single sign-on?
Sure. So that's a question we get a lot, and it differs in a number of manners. The first and most obvious is with respect to speed. Aventura's approach to our technology approach on our platform is really one of the premises it's based on is parallel processing. So you think about a lot of things that have to happen in order for a user to identify themselves, be authenticated, and have access to their applications. And that, in most cases, in most SSO cases, that's a serial process, or one thing has to happen after another, A, B, C, D, E, F, G. In the Aventura sense, because we can parallel process these things, we take all those things and do them at the same time. So if those 5 things each take 2 seconds in a serial manner, it's going to take 10 seconds. In a parallel processing manner, it's going to take 2. So first is speed. Second is really personalization. Because of the concept of awareness, we can personalize the desktop by doing things like automatically provisioning applications in certain areas and preventing access or deprovisioning applications in other areas. Because of awareness, we can enable printing to be localized, so that if I log on room 1 and 4 West, and then I go to room 5, I don't keep printing in room 1. I can bring that awareness to the point of care and customize that experience. And the last is around the patient centricity. Because we know who you are, where you are, and our good integration with our EMR partners, we can actually bring up the patient record for the clinician so they don't have to go hunting and pecking and find that record. So it really comes down to speed, improved workflow, and higher security.
Okay. We have another question from an attendee, and that is, if you could talk a little bit more about mobile devices. How do you secure mobile devices?
Absolutely. This is actually one of our key strengths, I think, in that you think about the workflow around mobile devices, and because they're non-tethered, they operate a little bit differently. In addition, obviously, the form factors are different as well. So one of the challenges with mobile devices is what's the right workflow, so that if I'm rounding and I just want to look up patient information, then I can go back and forth and log on to my iPad and look at my patient census and go back and forth pretty easily as I walk through. But if I need to do something in the computer system, in the EHR or other application, the mobile devices, the value proposition of the mobile devices tends to go down pretty precipitously as my need to use it goes up. So what you see is clinicians like to go and look at data on a mobile device, but interact with the application on a fixed device or something that looks like a computer or PC. So Aventura has a solution that we fondly call double tap, where a user can switch back and forth between the desktop session and a mobile session literally just by tapping their badge twice. And what we do is we port that, through awareness, we port that EHR session onto the tablet with the user and the patient in context, and we allow them to go from the tablet to the device and then back and forth every time they double tap.
Excellent. So another question from an attendee is, does Aventura have a recommended way, a way that your company particularly thinks is effective for clinicians to identify and sign in, whether it be a badge or a PIN or biometrics or all of the various solutions out there?
Sure, and given the way the question was worded, I'll try to answer in kind. From a recommended perspective, we think the badge is a particularly good way to do things. It's something that everybody already has. It's very easy to integrate, regardless of what a hospital or health system may have for badges or IDs. They all follow some pretty well-known standards and make things easy for companies like us to integrate to. However, there are cost elements that organizations may want to take into account. The readers aren't free, and PINs work just as well. So if you have the badge infrastructure already, we strongly recommend that, because it's something that someone's already carrying, and it does enable two-factor authentication, which we believe really makes a difference from a security perspective, particularly with respect to unauthorized access. Particularly if you think about a lot of the hacks that happen, they tend to go in through an unprotected PC with some passwords that were gained through social engineering, and it looks like the actual user is logging in remotely, and then they're gaining access to whatever those passwords enable them. If it's a DBA, then your organization is really in trouble. And if it's a clinician's access point, then you're going to have a breach of a high amount of patient records as well. But when you start implementing two-factor authentication, regardless of where that initial access point is coming from, without that second factor, the badge or the fingerprint, then the access doesn't happen. So we really try to advocate two-factor authentication. Biometrics is another excellent way to do that. Again, it really comes down to what's the organization's appetite for cost from an initial project to an extended project. Both are very good solutions.
Okay. I think it did. We have another question. How do you work with Epic?
Sure. So we have a number of Epic customers, and Epic is a great organization to partner with when you're working on behalf of their or our common customers. And we have, as I said, we have a great relationship. We have access to hyperspace and can do some pretty cool things from the user's perspective with respect to getting a user into their applications and locking down desktops in their very distinctive outpatient workflow as well as their more traditional inpatient workflow. So, I would say we have a very positive relationship there. We have access to their API library, and our joint customers are better for it.
Well, very good. That concludes the question and answer portion of today's webinar. And before we wrap up, I'd like to ask the audience to take part in the exit survey that will be popping up on your screen after we conclude. Thank you, everyone, for joining us today. You'll receive an email in the coming days with a link to the replay of this webinar for you to view again or to share it with a colleague. Thanks again, and have a wonderful day.
Great. Thank you.